what are you doing to help our coastal businesses build on this recreational economy that has really blossomed?
So the latest numbers on the recreation economy are about $11 billion annually. So this is a huge economic, multiplier. And whether it's guides or kayakers or the craft breweries, I mean, the list just goes on and on. And recently I introduced with two of the Congress's most conservative Republicans a bill that we call the R&R bill. Recreation, not red tape. And what the point of these bills are, and they're in both the House and the Senate, is, for example, to end some of the bureaucratic water torture that people go through when they try to get permits and things of that nature, to have a uniform permitting system at the Forest Service and BLM. And I think there is a lot of interest, particularly in the Energy and Natural Resources Committee that I chaired before I became the senior member at the Finance Committee, in a major recreation bill. And I think we all know, for Oregon, this is an economic bonanza, literally from one corner of the state to another.
Maggie, yesterday we had a panel with winemakers, and we kept saying, why, we need you. We don't do any wine growing on the coast. But they said, yes, but everybody wants to see and recreate at the coast. We want them to pick up a bottle of wine on their way. So we agree with you. Recreation on the coast has become a really big issue. Over one-third of Oregonians live in rural communities where access to health care can be particularly challenging. What are you doing to improve access to high-quality health care in rural areas? And thanks again on the prescription drugs.
Three areas, actually one and a half, that are really laud. The first, and something I've dreamed about, I'm looking around the room because I see people that I've worked with since my days with the Gray Panthers. Medicare today is not Medicare that we had when I was coming up. Medicare when I was coming up had two parts. There was Part A for hospitals, there was Part B for doctors. That was it. Today, Medicare is very different. It's cancer, diabetes, heart disease, strokes. Pretty soon, the biggest healthcare program in America is going to be about people who have two or more of these conditions. Might have diabetes and heart issues, two or more of the conditions I described. Orrin Hatch, before he retired, said he wanted to do a big Medicare bill. I said, I've got one for you. It is now being implemented, and for folks in rural areas, this will mean more home care for seniors at home, more use of non-physician providers, and particularly an expanded telehealth kind of service, which I know is very important for your rural hospitals. Second, of course, we know we've got a major problem with respect to opioids and illicit drugs. I just came from the Florence pharmacy, where I stopped to talk about some of the issues for the smaller pharmacies. And one area that I asked about is a provision I got through that a lot of you asked me for, was to allow the providers to directly prescribe to the pharmacy, so you wouldn't have so many prescriptions moving around in the community and on the streets and illicit drugs, and that's being implemented. Finally, in rural Oregon, as you know, we have a major mental health crisis. I mean, there's no other way to describe it. The suicide rate and the like. And the Federal Communications Commission just this last week said that they were going to start moving on my idea for a 3-number phone system, so that anybody who contacted that number would know that there is only one thing on the table, and that is making sure that the person on the other end of the line has an opportunity to access all the services, so we don't have our veterans and others committing suicide. Oregon is proud to lead in a lot of areas. We aren't so proud to be up at the top in terms of the suicide rate, and that third approach would help us turn it around.